I think the most important thing for us as Kenyans is going back and ensuring that the systems that we have are able to work, working systems.
Okay.
By working systems means that our doctors are reimbursed or paid well so that they can be able to serve. You don't expect somebody to go to medical school for 7-8 years and just come back and get paid peanuts. So it becomes harder. When you're going to Nairobi, you're going to expect to go to Kenyatta Hospital. That's one of our like our biggest hospital. So because the systems are not working, if you have recently been following up, you see that Kenyatta Hospital we don't have food for patients.
Wow.
Those are basic needs.
Okay.
There's no water, no gloves, Some of the machines are just there, they're not working. I just don't know the healthcare, what they have right now, SHA, I don't understand it very well. But I know that if we can be able to improve our systems, the systems that can work, we can be able to deliver.
No, that is something that doesn't happen in Kenya. Remember, in Kenya, we've just, most of the people in Kenya still go to hospital with books. Kama kitabu unaandika hapo, unafaa kwa kitabu, next time you're sick, you go back to hospital so the doctor can read the book, aangalie vitu umetibiwa, alafu aendelee kutoka hapo.
The 2026 annual conference of the Kenyan Nurses Association of America, KNAA, is happening in Baltimore from September 17th through the 19th at the Sheraton Baltimore North Hotel in Towson, Maryland. Early registration is now open at $250 until July 1st. After that, it goes up to $300. Vendor and sponsorship opportunities are also available, but space is limited. Registration details are on your screen, and the links are pinned in the comments and description below. For inquiries, call 848-224-1201 or email info@kenyannursesUSA.org. That's info@kenyannursesUSA.org. Every week, somewhere in the diaspora, a family WhatsApp group gets quiet for a moment. Then the message comes in. Someone is sick, a diagnosis came late, or the bill is too high. Suddenly, what should have been a routine healthcare issue becomes a fundraising emergency. But tonight, we want to ask deeper questions. Can Kenyan healthcare workers in the US help build real solution for Kenya's healthcare challenges? From delayed diagnoses and unaffordable medical bills to telehealth, patient advocacy, and the pressure families abroad carry daily. Can Kenyan doctors and nurses in the diaspora help close some of these gaps? Now, our guest tonight, Dr. Jeliah Akombe, has lived that bridge. She's the founder and president of the Kenyan Nurses Association of America, KNAA. She's a dual certified family nurse practitioner and psychiatric mental health nurse practitioner licensed in over 10 states. Now, Dr. Akombe also has experience across emergency care, primary care, mental health, public health, and underserved communities. Now, through KNAA, she's working to unite, empower, and elevate Kenyan nurses beyond just being caregivers into being leaders, advocates, entrepreneurs, and community voices. Now, lately, Dr. Akombe has been working tirelessly to organize the upcoming KNAA conference happening this September in Baltimore, Maryland. Details are in the comments and description. Make sure you check them out. So without much further ado, ladies and gents, type Karibu in the comment section below and help me in welcoming the bold, the visionary, the dynamic, Dr. Jeliah Akombe. Daktari, karibu sana to the OneMic Show. How are you doing today?
Thank you so much for the wonderful introduction. I thought you were introducing somebody else.
Oh,
Thank you so much.
No
one but you.
It was no one but you. This is exactly you, and this is what you've been doing. So that's very good. And thank you so much for being in studio tonight. Before we get deep into KNAA, the conference, and the big healthcare questions tonight, take us back for a moment. As a Kenyan nurse in the US, when you hear those diaspora stories ranging from urgent bills, WhatsApp fundraisers, and deaths from misdiagnosis from back home, what goes through your mind, Dr. Akombe?
Big heartbreak.
Okay.
Yeah, because I know that Kenyans, we are very, very brilliant people. We have brilliant minds. Kenya has great doctors. It has great nurses, great healthcare providers back in Kenya. When we come to the US, I'm just going to talk about the US. We have great minds. We have brilliant nurses, very experienced. We have experienced doctors working here. We have nurse practitioners. So we have the manpower to help our country. So I think the most important thing for us as Kenyans is going back and ensuring that the systems that we have are able to work, working systems.
Okay.
By working systems means that our doctors are reimbursed or paid well so that they can be able to serve. You don't expect somebody to go to medical school for 7-8 years and just come back and get paid peanuts. So it becomes harder. You know, the footballer is paid more than the doctor who has gone to school for a long time. So we have to prioritize our health, ensure that we are taking care of our providers, healthcare providers, so that they can be able to afford to take care of our patients. So if they are not paid well, how are they going to even be able to pay their rent, transportation to and from work? So that's like the core. Also, let's look at the big picture. Like we have, like right now, we have most of the good hospitals. If you want to get good health care system, you have to go to Nairobi or like the bigger cities. And when you're going to Nairobi, you're going to expect to go to Kenyatta Hospital. That's one of our like our biggest hospital. So because the systems are not working, if you have recently been following up, you see that Kenyatta Hospital we don't have food for patients.
Wow.
Those are basic needs.
Okay.
There's no water, no gloves, you know. Some of the machines are just there, they're not working. I just don't know the healthcare, what they have right now, SHA, I don't understand it very well. But I know that if we can be able to improve our systems, the systems that can work, we can be able to deliver the care that the patients in Kenya need.
Now, Dr. Akombe, this sound like some very deep, complicated healthcare issues that Kenya is experiencing. What is it that, like made you feel or even imagine that nurses in the US or healthcare workers in the US can be part of the solutions? Because these are very, very deep problems we're talking about.
Kenyan nurses and Kenyan doctors in the US can be part of the solution. We can be part of the solution by being partners, working together with our nurses and doctors in Kenya. So if we can work together, we can be able to make many changes. So for example, let's take an example of India. India has taken telehealth very seriously, where they have get doctors from other countries who are able to take care of patients, including surgery, telesurgery, or robotic surgery. From a doctor is operating a patient from the US, but they are in the US, but they are doing operation on a patient in India.
Wow.
So if we can be able to work together, first of all, by working with the government to allow us to get licenses without putting restrictions so that we can be able to work together. Because there are so many restrictions that make it harder for us to, even when you go back to Kenya to work. So if they can do the improvement on licensing, that will be the first step. And then we can also be able to set up telehealth services where we can have, like, if, let's say, in my village in Nyamira, somebody's sick, they don't have enough service, they don't have the resources. We can tell them, okay, we want to send you to this particular clinic, or we want to send you to this particular health center. Do this blood work. And that particular health center will send the blood work to us.
Okay.
We will look at the blood work, and then we'll look at the symptoms of the patient. And we can communicate with the doctor there or nurse and tell them this is exactly the treatment plan for this patient. So that will help a lot of our patients who right now do not have the kind of healthcare they need.
Amazing stuff. And we're going to be talking about that all through in detail today. Want to remind the listeners, you're tuned into the OneMic Show. The number to call is 202-683-4570. Press star 5 to speak. Dr. Jeliah Akombe in studio, like dropping some wisdom, and we're not even started yet. I can see we have people here already tuned in on YouTube. We have here Zipporah Kebati. She says, watching from North Carolina. Karibu sana, Zipporah. Thank you so much for tuning in. We have Hanigal Njeri from Houston. Hi, gents. Karibu sana, Hanigal. And then we have Ben Misiani. Anasema good luck. And then we have quite a number of people tuned in. Again, the number to call is 202-683-4570. Press star 5 to speak. Get details on the conference below in the description and in the comments. We're going to be talking about those. Now, before I know I'm being signaled that we already have a caller, but before we get to the callers, I want to first introduce the panel because it seems this is a very big topic. I was getting questions from all over.
Right.
You know how I know a topic is big? When these flyers get to my mother, you know, like even before, you know, like that's when I know. That's when I know the
you
topic is
printed
big.
it and she saw it at the printer.
That's when I know the topic is big. You know, like
my mom
my
yeah,
mom is currently in Seattle, Washington, attending a graduation.
Are you sure you
Yes,
did not
and she
fax
found
it
it.
by mistake?
Anyway, DJ
Moshfire.
Moshfire.
Yes, sir.
As we get started, you're one of those who's been in the US for the longest on our panel here. You know, like not to call out your age, but you've been in the US since 1989. Quite a long time, longer than any one of us here in the panel, and I believe any of our listeners. When you think back now, when you think back to medical emergency calls from home over the years,
OneMic.
how ngoja kidogo, you know, like because the context of this question
Yes, sir.
has to do with how these medical emergencies have been changing over the years. So you're the only one who can give us this context. When you think back to medical emergencies calls from home
Yes.
over the years,
Yes.
how have they changed? Are we seeing more of them now? Are the bills getting bigger? Are the reasons different? Or has the pressure on diaspora families become heavier? Give us your 2-minute version from your experience. DJ Moshfire, karibu sana.
Hey, that's a heavy question. Okay. So, I'd say when I first landed, any things to do with home, whether it was emergency, death, blah, 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 was basically a phone call in the middle of the night. And so if you got a phone call at 3 a.m., you don't answer that one. You just wait till 8 because the news will still come.
Yeah.
You kuja at 3 a.m. ulali. Now, those were normally either there's an emergency, ama mutu ameaga. Those 3 a.m. calls.
Wow.
That's like when those ones used to come. Now, in terms of emergencies, when it was feasible for us to send money, which basically was Western Union, this is
Pre-Sendwave.
Pre-Easy Vitu. I'm not going to advertise anybody, but pre-Easy Vitu tunatumia hizi apps.
Yes.
Right? It was pretty much tunaenda Western Union. Though I didn't want to say that, but that's what we did. It was Western Union on Atumaizo, and it was those requests were normally for immediate family. It wasn't for extended. It was like maybe mom calls you, dad calls you, or something like that. But it wasn't you're getting from an uncle, cousin, sijui a distant relative from sijui wapi. And over time, it has morphed and progressed to the point where, because now we pretty much have it on our phones, point, click, anybody and everybody has an emergency. Now, emergency can be mtoi aendi shule, awanataka kwenda kusiaga, sijui hakuna maji. Hiyo ndio emergency, meaning emergency yake sasa ni emergency yako. So in terms of the diaspora, it has ranged from help to regular sustenance.
Okay.
And that comes from help, it comes from medical all the way to day-to-day living.
Okay.
Just because things have drastically changed. So the black tax, as we call it, has
increased
substantially.
Okay.
And it continues to increase.
Black tax hapo mwisho. Nilikuwa nataka kuambia unaita black tax emergency.
Okay, Mika ngoja Mosha malize. Yeah. Ngoja Mosha malize. Yeah.
Omera Mika, come slowly.
Yeah.
But so things have really progressed. So what we used to term as emergency and what we knew as emergency is now no longer an emergency.
Yeah.
It is basically wewe ndio ule mtu wa kuniokoa. Okoa jahazi. Now, okoa jahazi can be anything. That range is so wide.
That range
so
has
medical
widened.
is just happens to be one of them.
Okay. But it has broadened.
In fact, niseme it's extreme.
Okay.
Yes.
All right, let's go to Mika. Now, Mika, you work around healthcare data. Before Dr. Akombe helps us unpack the nursing and system side, what does your experience tell you about the difference between healthcare decisions based on clear information versus families making decisions in panic with incomplete information? Mika, twende kazi, your 2 minutes.
Okay, so thank you very much, Ali, and I want to welcome all our regular changiajis on this our special show on a Thursday, and to welcome our guest here, Dr. Akombe. And the doctor here can back me up on this thing. there's something called continuity of care, which continuity of care basically means is that when you go with whatever hospital you walk into, they can be able to pull up your medical records and be able to see your records even as far back as birth, right? That's depending on when you were born. But then we can just, let's say, for example, somebody like Omosh, tutapata records zake kwa 30 kwenda mbele. Hizo zingine 30 zoko nyuma tutakosa. But still, we have his medical records for the past 30 years. Now, that is something that doesn't happen in Kenya. Remember, in Kenya, we've just, most of the people in Kenya still go to hospital with books. Kama kitabu unaandika hapo, unafaa kwa kitabu, next time you're sick, you go back to hospital so the doctor can read the book, aangalie vitu umetibiwa, alafu endelee kutoka hapo. Now, you see, that's where the continuity of care comes in, when there's no integration of data. And then this makes the work of the clinicians, who nikina Dr. Akombe, a little harder, because they don't have that, they start second guessing, or they start trying to treat you based on your current symptoms, that maybe you have other pre-existing conditions. So that is why we find sometimes you say a patient was misdiagnosed, but the patient was correctly diagnosed at that particular moment. It's just that there was some other things inside them, and the medication might have affected them because of causation or correlation of what they have. Now, when it comes to family, when you go to a hospital, you trust the doctor to know what they're doing. If the doctor doesn't have the information of what he or she is treating on, they're also treating you from a blind spot. They will use the experience on what they can know right then, but without that whole getting to be able to access those records as much as they want, it's what makes it hard even for families in making decisions. Now, you see, if, let's say, for example, I'm in Kenya, I'm sick, and I call my relative, Dr. Akombe, and she asked me, what did the doctor say? And I said, do you know what? Let me send you an email of the diagnosis and what she said. And she can be able to read that diagnosis with her expertise. She can be able to advise us and tell us, hey, you're panicking, relax, there's a better course of treatment that you can do. Or like, it becomes easier for families making these decisions. So from my experience, is like, as she was saying, making it easy in terms of giving them licenses and making them easy to go back to work, but also integration of the healthcare data makes it more easier for the practitioners and the families on how they take care, and also makes it cheaper, because now we know what you're treating. We're not doing unnecessary tests all the time we're going to the hospital.
Okay, all right. Asante sana, Mika. That comes from someone with expertise in healthcare data. Very good information coming from Mika. Before we go back to Dr. Akombe, and I know there's already people who who've already called in, which shows you the gravity of the topic that we're having today. OneMic, from the Baltimore community side.
Yes.
When hospital bills or fundraisers come from Kenya, what do you see happen inside families and WhatsApp group? Is it just generosity and the Harambee spirit kama kawaida? Or are we starting to also see fatigue, pressure, and even mistrust? Mike.
It's a combination of both. So I have been in the presence of nurses who, when we receive, or when certain information is received from the other side, they go through a checklist. Mm-hmm. So Omondi has been, they've gone to hospital and they've done this and this and this. Then usually the nurse will be like, okay, can we get this and this? Where was this done? Where was this done? Where was this done?
Yes.
Okay, this person is not going through this. Have you done this? Have you done this? Have you done this? So there's and I've seen, and I mean, like, even when stories that you sit down, when you hear sometimes, and Mika is right, sometimes they will misdiagnose something because they haven't gone through a test. And we're talking about nurses who will go and see a patient, a relative of theirs, maybe they're traveling, they're in Kenya, right? And then somebody happens to fall sick, and when they go in, they're like, no, this person is going through this and this and this,
and
not this.
Ooh.
Right?
Yeah.
So, and yes, there's also that there's also that issue of some places just prescribing certain types of treatments just to make money.
Yes.
So there's also distrust,
The
because at some point,
profitization
because we also tired. I mean, you can say the black tax, but there's also like, okay, what exactly is why is this place is not being truthful? You get a call. The first thing that you're being asked is, okay, to be admitted, you're being told is 240,000, 250,000 Kenya shillings, and that is upfront.
Yeah.
Before anything. Then after that, each and everything you'll be told is maybe it's 80,000 Kenya shillings a day.
Okay.
Right?
Okay.
And now, this is one person, but now the community has grown. I'm just talking like in Baltimore, it has grown. Now you can imagine Texas, Mississippi, Seattle. And by the way, remember, you've got friends and family in all of these spaces. So at some point, it does become a drain. And you wonder why the healthcare system, sometimes you start questioning, why is this thing being pushed yet it's not doing anything?
Yes. So,
but it becomes one of those where it's double-edged. It should work, but it's not working. But people are also really getting drained financially because, again,
and mentally.
Okay, good. We're going to come to Dr. Akombe, but before that, I want to read a few comments here. And I also want to do, like a quick, like promo of the conference that's coming up, because it's very important for you to know everything. But before I do that, like I'm going to read a couple of comments here that are coming in on YouTube. I see here, this is... Diana Lucy anasema, wow, Kenya needs partnership indeed. Karibu sana Diana. And then Grant Verde anasema, what is that call number? We're gonna give you the call number. I know people are already live on the call. And then we have Caroline Jaber anasema, watching from DC, good job. President, let's go KNAA. Then we have Joy Ajwoga watching from New Jersey, karibu sana Joy. And then we have Caroline Yak B anasema, good evening Dr. Akombe, thanks for your leadership so far and the vision for KNAA. Then Hosilando anasema, good evening. We also have Diana Lucy again here commenting and saying, hello, tuning in from Dallas, Texas. My heartfelt gratitude to Dr. Akombe for her benevolence and visionary leadership. And then we have Hosilando saying, can we mention intentional misdiagnosis to milk those patients who appear to have means? We're going to be talking about that later on in the show. And then Grant Vrande anataka number. We're going to be sharing the number shortly, so stay tuned. Now, before we go back to Dr. Akombe, I wish to remind the listeners that the 2026 annual conference of the Kenyan Nurses Association of America, KNAA, is happening in Baltimore from September 17th through the 19th at the Sheraton Baltimore North Hotel in Towson, Maryland. Early registration is now open at $250 until July 1st. After that, it goes up to $300. Vendor and sponsorship opportunities are also available, but space is limited. Registration details are on your screen, and the links are pinned in the comments and description below. For inquiries, call 848-224-1201 or email info@kenyannursesUSA.org. That's info@kenyannursesUSA.org. Make sure you register before it's too late.